Hello everyone. So this is a case of Hallux, the virus with the rigidus. So we will approach this case with the minimally invasive, MIS the percutaneous approach. So we always start with the marking first. We identify the joint with the help of a KY. After identifying the joint, with the help of the small your mosquito forceps, you basically create a space dorsally as well as plantarly. Followed by that, we basically go inside the joint with the help of a Shannon burr, and I basically measure the depth also, and then I start shaving it, start burring the cartilage in a I go in lateral direction, then comes out little medially and goes up and down like this. And continuous irrigation of saline is I always take care of. My assistant will keep on pouring the water over there, then as normal saline over there. And after that, preparing it, I basically distract it and then compress it. During the procedure, my assistant will pull the toe into a distracted position so that I can work on the proximal surface and the distal surface. So when I'm confident about the joint preparation, then I put 2K wires in a cross-sectional direction in a crossing manner. And after putting these 2K wires, basically I use headless screws. You can see the two wires here in a crossed manner. Everything is aligned. Then the incision will be made for the headless screws. You can use 2.5 also, 3.5 also. If you don't have headless screws available, because not easily available, you can connect with your arthritis guy, you can connect with your nebula guy. Now there are another Jews, Bontech, a lot of companies are there, who are also providing these kind of screws. Then screw them up and tightly check it, hold the position also. Now this patient, if you've noticed, had a toe problem, the great toe as well as the small toe problem. So I did perform the DMMO also. Look at my hand position. I'm starting at a 45-degree angle and I'm going into the pronated position, and starting into the neutral 45-degree angle, and then taking my hand into the pronated position just to cut that off so that the head goes into the lateral direction. Some people say it should medialize more, like it should be medialized like in a convergent fashion. And some people say just do it and leave it. Sometimes I try to push it, the head, after cutting it. I try to push the metatarsal head in a particular direction where I want my toes to be. So I do that also. You can use K wires also, because sometimes these DMMOs, if you are doing it for the first time, you can use K wires. You realign the toes and you put a K wire so that it heal in that fashion, or you can rely on the taping also. Taping is basically a tedious thing. No. So you can see the differences between the two. So this is about the MIS, minimally invasive Hallux virus fusion. So this is how you can do it. Thank you. And stay tuned, keep on following for more of the MIS update. So this is Dr. Chandan Narang, your foot and ankle surgeon. Thank you.